Now, I know it's difficult in next 15 minutes to cover everything, but what I will do, this is my thoughts. I don't know how much successful I'll be to cover all this. But when you're talking about doctor-patient relationship, you have to appreciate the patient's perspective, the doctor's perspective, the other aspects of cancer management. Few words about cancer awareness because we need to all discuss this. It's high time we talk about it. And at the end, I will share with you a small story just to, give it some interesting aspect of how, good leadership, good public relation, and sincere dedication to do something for the society can make a mission impossible very much possible. Now, this is rather scary. I don't want to scare you on a Sunday afternoon, but the incidence of cancer is actually increasing very rapidly. And by 2020, every fourth person is going to have cancer, which is rather scary. And every morning when I wake up, I always think if it has to happen in my family, let it be me, but I don't have any control about that. The good and bad thing about it is 50% of this cancer, the cause is known, and very little is done about it. And I will try and cover this very quickly. Now, coming to the problem which Mr. Mantosh had, colorectal cancer, cancer of the colon or rectum, they behave similarly. So the questions I will have for Mr. Mantosh, you don't have to look at the slide, but I will start very quickly. Mr. Mantosh, I never thought about this, but when I, had been telling people that I have to interact with Mr. Mantosh, a lot of people asked me, how did you get this surname, Mr. Mantosh? Very quickly, do you want to say this? It's rather
Actually, my grandfather was a Sarkar, and my grandfather was a Sarkar, and my grandmother was Swiss. He was Mantosh Sarkar, and he became a Christian, and he made his first name into Mantosh. In those days, Mantosh used to be spelled and pronounced as Mantosh. So that's the surname came from that. And he became a Catholic, and then he married the Swiss lady. So again, there was a thing that he spoke Bengali and she spoke French. So because of that, the common language was English. So that's why, in a sense, my mother tongue is English.
That's wonderful. That's very interesting. Slightly personal question to start with. But what were the symptoms? I know you had been suffering from irritable bowel syndrome, which means, the stress causes the bowel to go, really irregular. So you can have very frequent bowel movements. You can have constipation. You can have acidity. So those sort of problems he was always having. But then something new cropped up, I think. Some new symptoms developed. So just to give you an idea how the cancer can actually, show itself, can declare itself in a patient, and the patient gets some hints about something going wrong. So, Mr. Mantosh, what were your symptoms when you thought something is not right?
Really speaking, there was no sudden dramatic symptom. The IBS symptoms slowly increased more and more. Slowly increased more and more. It started round about February 2011, March 2011. It was slowly getting worse and worse, the symptoms, and I was taking routine medicines for IBS. In May 2011, I had to go out in the very early hours of the morning. And when I came back and I went to the toilet, and I found in the commode there was full of pinkish liquid. I still didn't think anything. I thought it was just undigested tomatoes which I had for dinner. But by November, December, it was really bad. I was running to the toilet about 20, 25 times a day with that pinkish liquid coming out. Then my sister-in-law, who's a doctor, she insisted that I should go for a scoopy. And it was detected there's a tumor inside, and well, that meant it was found that I was suffering from cancer. So that's the answer.
Right. So you saw some blood in the stool which you never seen before. That was a new thing which you obviously saw, and then you had some tests done. What was exactly done to confirm the diagnosis?
Scoopy was done.
So colonoscopy, which is basically putting a camera inside the back passage.
And then a material was taken out and tested.
Right.
And it showed that disease.
So I'll tell you, there was a tumor which was sitting in the junction of rectum and colon, and that was obviously looking malignant, and they took a biopsy, it came as malignant, and then obviously the diagnosis of colorectal cancer was made. And I want to know, what was your reaction? Because it can be a very ghastly thing to know about, that you have got a cancer. So I want to know about your reaction. How did you react to this diagnosis?
I must say I never felt completely lost. Right. Never, ever. I was more worried that I can't go about my work because, I mean, sometime one day I remember in court it was bad condition, I had to rush home to go to the toilet. That was the principal problem. But I was worried how it would affect my work in the long run. But I guess I had trusted that I'll get well.
So fortunately, he was very strong. He took it, with a lot of guts. But we see people who are totally devastated. And we sometimes have, family members who will come and tell us that please don't tell the diagnosis to the patient because he'll be kind of mentally very depressed. He'll not be able to accept the treatment. So sometimes we have to go through that, procedure where we really try to hide away the proper diagnosis, but give them some hint that something is not right. But for him, it was a straight diagnosis which he accepted, and he was brave enough to, face the situation. Now, the next thing which I would like to know, how did you decide where to go? Because I know you've got your roots everywhere. You got your family members in Europe, in Switzerland, in Singapore. So why did you choose Calcutta and that to Thakurpukur Cancer Hospital? Because, somehow, although this hospital has been 40 years old, not too many people normally would go there. Those who can afford to go to a private hospital, they go to a private hospital. But the kind of experience we have, a lot of people don't appreciate that. And I was surprised why David Mantosh came to us to tell that, this is why I want to have the treatment. So just your thoughts, why you decided to choose this hospital.
Well, I know there were many large hospitals in Calcutta having the best of medical treatments, very best. I mean, world standard treatment. But I had heard from my friends that in Thakurpukur, the ambience is a family type ambience. I wanted rather, I'd say, to go where I could have a family type ambience. I must admit that it came to my mind that if it becomes fatal in the hospital, I felt I'd prefer to it occurring fatal in somewhere with a family type atmosphere, a home like atmosphere, with the pond and all that. One could look out into the pond when I saw it when I was in the hospital, rather than in a huge concrete block of a hospital, no doubt, with very good air conditioning and everything. But I felt that came second to me compared to the homely atmosphere and what I believed was, and in fact it was, a very personal, caring looking after. That's why I took it.
I must admit that the philosophy we follow in our hospital, and I'm sure many doctors will follow, I personally follow as well, that you have to consider each patient as your family member, and that's when the best decision comes from you. If you start looking at the patient as a customer or your client or something like that, then obviously you'll be thinking in other aspects. You don't really want the best thing to happen to the patient. Well, not the best thing in that way. Maybe you'll order not a lot of unnecessary tests, a lot of unnecessary things will be done. So that's something we never should be doing. So when you are talking about public relation in my field, with the patient, I always think that patient, if it had been my family member, what would I have done with that sort of situation? And always give a priority to the economics. For him, it was not a problem, but a lot of people do have financial constraints, and you must respect that kind of problem. Now, my kind of concern when I saw him, there were 2-3 things which really concerned me. One was his body weight at that time. He looks really healthy now, but you would not believe that he was only 41 kilo at that time, very thin. He had a very bad cyst. He was a chronic smoker. I learned recently, I met him only just a few days back after a long time, that he has stopped smoking ever since he had the diagnosis, so that was a wonderful thing to do. But at that time, he had a very bad cyst. The anesthetists were kind of scared of giving anesthesia, and I know one hospital actually turned him down, giving all the risk factors that he's going to be high-risk surgery. Thirdly, it was a big tumor sitting in the tummy. I could feel it from outside. Fourth was he had some obstruction. The stool was not passing out completely. So if you have a lot of stool built up inside, there's high chance of infection. So we talked about giving him a bag maybe as a temporary basis. And the fourth thing, which I'd like to admit today, he was a lawyer and he was very well connected. So that was a concern for me. You might laugh, but that's something I was kind of a little bit scared about. But I thought he's my family member. He has put full faith on me, and I will try and do the best for him. Fortunately, we managed to clear his bowel out. And we could do a one-step surgery. We resected the colon, joined it back again, and without giving him a bag, not even on a temporary basis also. He had an uneventful recovery. Now, I think you already mentioned about your expectation from the hospital. Now, having kind of defeated the dreaded disease, how do you feel now, after maybe 3.5 years now?
I feel, it's not only what I feel, everybody says that I'm more healthy and more active than I was before the operation.
Sure.
So I'm perfectly okay.
Wonderful.
I travel everywhere I want to go. I
Right.
travel abroad. Everything. I have nothing to.
Right.
No.
Any message for the audience, this learned audience, learned forum?
I would say that when a person goes to a hospital, apart from the naturally apart from the question of medical skill and equipment, there is another factor which is very important, if not more important. That is it a personal care or is it an impersonal care? An impersonal care, one soon realizes, is nothing. The personal care is the thing that matters. I feel that's the thing when any young person or anybody goes to hospital, what he should think. Not the famous hospitals, but a hospital where he knows that he'll be looked as a human being, not as a bed number.
And I think secondly, I think you want to tell the audience that, not to get frightened about something which is going wrong in your life. It can be cancer, it could be anything, it could be heart attack. So you must face the challenge with a lot of, courage. So that's something I'm sure you'd want to share, definitely. And thirdly, not to neglect any symptoms, which I will try and cover in the next few slides, because I'm here as a doctor as well. And my job, my mission in my life at the moment is to try and, combat cancer as much as possible. Because I told you the saddest part, that we are actually neglecting symptoms. We are not, we are not kind of prepared to, have preventive measures to stop cancer, problem in our life. So those few slides will be, coming up very soon. But I would like to thank Mr. Mantosh for what you have said. There might be a few more interactions while I'm talking about cancer in between. Now, just to tell you, while discussing about colorectal cancer, it's impossible to talk about all cancers, but I will just finish off very quickly about colorectal cancer, that most of the cancers happen in the last part of the colon or the rectum. And this is an area which is very easy to diagnose. And a lot of people, put down rectal bleeding, blood coming with the stool as piles or fissure or something like that. So it's not, something you should be doing. You must get yourself checked if somebody is having rectal bleeding, which he did, although with some bit of delay. And like I said, since most of it is accessible with the tip of the finger and some instruments which we have in our clinic, it's not that difficult to diagnose this colorectal cancer. The symptoms he has already mentioned. I'm not going to run through that again. These are the small instruments which we have in our clinic, and it's quite easy to pick up colorectal cancer. And you might ask, what's the cause for colorectal cancer? Well, 5% of it is hereditary, but the remaining 95% is just bad luck. So anybody can have it, but the good thing is curable like any other cancer. You just have to be careful about the symptoms. 5%, yes, it's genetic, and I will just share with you a couple of slides. This young man had his mother, his maternal uncle, and his brother suffering from colorectal cancer. He came to us with some rectal bleeding. We did a colonoscopy, and we picked up multiple hundreds of polyps, which are like small tumor kind of things in the colon. These are all, each one of them is precancerous. So what we did for him is remove the entire colon and rectum and join the small bowel to the back passage, and now he's 10 years down the line doing perfectly all right. And another interesting slide, these Siamese twins, both of them actually had a tumor in the right colon, so we did a laparoscopic right hemicolectomy, and both of them are doing well for the last 10 years. So just few hereditary things, but most of them is just bad luck. So the message for colorectal cancer is not to ignore any rectal bleeding, change in bowel habit, and early diagnosis and treatment for any cancer is very important. Few cartons drawn by me. This is a page just to show you that smoking is bad, tobacco is bad. You might say, I'm just causing damage to myself, but you're actually causing damage to somebody else. It might be your close family member sitting next to you. So active and passive smoking are both bad. So anybody in the hall who's actually still using cigarette or tobacco must stop. And it's not only cancer, but you can see the whole list of problems. This is only half of the body. If you had to look at the rest of the body, there are few more problems I could have said. So it's endless problems. You can have a heart attack, lung cancer, even chewing tobacco is bad. It's almost equivalent to oral cancer, and you can see the kind of cancer one can have because of tobacco usage. Even this, just interestingly, when I was coming to this hall, the Ola cab driver was actually having his tobacco parked inside his cheek, and he was talking with difficulty because he had already had some mucous fibrosis, which means he was not able to open his mouth properly. So he already has got some precancerous problem. Tobacco is the most important cause of cancer death and also for heart attacks and other things. And 1/3 of all cancer is because of tobacco. And the risk is down to normal. You might say, I've been smoking for 10 years, what's the point stopping now? But even in 10 years' time, the risk will come down to anybody who's actually a non-smoker. So it's never too late. I'm sorry, it's going too fast. And to tell you a few important messages about how to prevent cancer. Just a small list of it, few tips. Regular exercise is very important. So if you can spare some time, especially in the morning, you must do it. Have healthy diet, plenty of fruits, vegetables, and water. Avoid junk food. 1 or 2 odd meals in a conference like this is all right, but not on a regular basis. Try and have some healthy diet. Avoid being overweight. That's not good, especially for obesity, hypertension, heart problem, and also cancer. Avoid tobacco and alcohol by any means. HPV vaccine for young women is important because there's a virus which can cause uterine cancer. That's the commonest cancer we used to have in India, and 90% of it can be prevented by a vaccine called HPV vaccine against that particular virus. And don't ignore any danger signals. That's a message you should be spreading around. For women, another word of caution, that you should be examining your breasts on a monthly basis, especially after the periods, especially if you have a strong family history, and that's the way to do it. You should be standing in front of the mirror, check the sizes of the breasts on both sides, lift your arms up, see whether the breasts are going up equally on both sides, and press on your hips, see whether there's any dimpling in the skin. And the last, but not the least, which is most important, is to lie down, have your hand on the behind your head, and with the opposite hand, with the flat of the hand, not with the tip of the fingers, one should be examining the breast. And if you feel any lump, it doesn't mean that it's cancer, but you should get it checked by the doctor, and they can do the relevant tests. Just a summary from the website of UICC, which is an European Union of Cancer Control. Whatever I have mentioned, that's all they have said. And last part of my talk, another 2-3 minutes, if the organizers agree with me, to share with you how a strong determination, good public relationship, and a will to do something for the society can do a huge difference for the society. My late father, Dr. Gupta, he used to see, while working in a cancer hospital in Calcutta, a lot of people lying on the street, not getting any seat in the hospital. So he felt that if I could do something for these patients, at least give them a shelter, a home away from home, which Mr. Mantosh rightly said, at least let them have a little shelter, some basic care. And that's how he started selling his idea to a lot of people. And he used to believe in what we all say, might have all different religions, but the essence of our religion is you should be loving human beings, you should try and do something for the human beings, and that's how you can reach God. Just a very old slide. In 1973, that's how the hospital used to look like, a barren land with only a hoarding. And within 1 year's time, when he got this piece of land from a patient, he had to do something, otherwise he had to return the land back. So he had that challenge. And what he did, he wrote a drama. He was a very good author, wrote a drama and acted as a cancer patient. He was pleading to the doctor, those who understand Bengali, what he was telling. Doctor, please amake bachan. Doctor said, no, I don't have a bed. Ki bollen Doctor, bed nei? এত বড় শহর, এত বড় বড় হাসপাতাল, আর আমার এই ছোট্ট দেহটুকু রাখার একটুও জায়গায় ডাক্তারবাবু, আমি যে বাঁচতে চাই. So what he was literally saying is, you got such a huge hospital, such a huge city, but you don't have a small place for a person like me. I want to leave for my family. Thank you. So that brought a lot of tears to a lot of people sitting in the hall. They contributed 50 rupees, 100 rupees, whatever they could. And within 1 year, he managed to set up a little home, 25-bedded dormitory. And thereafter, a lot of people came forward, not directly, helping with money, but being with him. Indira Gandhi, you saw Amitabh Bachchan, Jaya Bachchan, that was me during my medical school days. Mother Teresa, a lot of, famous faces you will see. And they had all stood, beside him. He mobilized all the school students to shell out a little bit of pocket money, and it's like a project by the people, for the people, of the people. And you'll be pleased to know that with that strong determination with the people, help from the people, from the society, what he has managed to achieve before he passed away. We've got a wonderful building for latest diagnosis, including PET-CT and MRI, Linac block, which is basically radiotherapy viewing with all the modern facilities, amusement park for the children. As you say, the ambience is very important. You can only do certain favor for the patient with your medical science, with maybe nursing, but what is also important is the counseling, the human aspect, and also the ambience. My elder brother happens to be an architect. He was trained in US. With Mother Teresa's request, he actually came back to help him with the pediatric project. So we got a lovely toy train, we got a wonderful ambience, latest of facilities, and the children are involved in different activities so they don't feel depressed. It's very sad when you see a child suffering. 5% of all cancers will actually affect children, but the good news is, if you can treat them properly, 95% of them will get cured. It's important to make sure that they manage to complete the treatment, so you need to mobilize funds for them, even for the poor patients especially, and we get them involved in different activities. They have to be in the hospital for 6 months, and with this, little rakis and diyas, we tend to sell them and get them some money in addition to what we are doing. They are involved in different activities, Ratha Yatra, famous musicians from all over the world come and entertain them. So it's like, real holistic care. That was I was trying to tell. We have a monthly birthday party where the children are actually celebrating their birthdays. And we try to fulfill the wishes of the children through Walt Disney. And that's the kind of charitable aspects which we do. We still maintain the same philosophy of serving the underprivileged people. It's not easy. It's a challenging task. We don't take any direct help from the government. And we have to really raise funds. And we do have a cross-subsidy model. So the people who can afford to stay in cabins like Mr. Mantosh, we do generate some revenue to help the poor people. And it's not important, like a message to the young people, that if you really want to achieve something, if a double amputee can scale a Mount Everest, I'm sure people like us can do a lot of impossible things, and make them possible. And that's for the benefit of the society, not for your own benefit, really. And if you really want to see a change in the world, you might be blaming a lot of people, Narendra Modi and other people. But I think I'm not a supporter of any politics. But what I'm trying to say that if you really want to see a change in the world, you must do it yourself. And I'm a strong believer of this. Very nice statement by Mahatma Gandhi, that you should try and do it yourself. And just to finish off, that even as a doctor, I do have this constant strain of running the administration, doing stressful cancer surgery, seeing people dying. Not all of them can be cured. So I have some pastime like painting and music, acting, playing cricket. But what I really wanted to be was a pilot. You won't believe me, but I wanted to be a pilot. When I was to tell my father that I want to be a pilot, he used to laugh and he said, you're going to spoil your career. So I did manage to complete my medical school, but while I was in UK, I did have some flying lessons. At that time, it was affordable. But what I like most is to spend time with the children, because they are the future of the society, and we want to make sure that every child gets to have a complete care, proper care, and make them cured. And at the end, after a boring lecture, what I will do is a couple of lines to encourage all the people. A couple of Hindi lines from Hindi song. May not be a proper voice at the end of the talk. Ruk jana nahi tu kahin haar ke, kaanton pe chal ke milenge saahe bahar ke. Ruk jana nahi tu kahin haar ke, कांटों पे चल के मिलेंगे साहे बाहर के. हो राही हो राही हो राही हो राही. Thank you very much.
तुम बेसहारा हो तो किसी का सहारा बनो, चाहे रास्ता जितना लंबा हो, नदिया को फिर बहना पड़ता है, हंसकर जिंदा रहना पड़ता है, फूलों को फिर भी खिलना पड़ता है. तुम बेसहारा हो तो किसी का सहारा बनो.
Well, as they say in Bangla, ভগবান যে ঘরকে যা দেয় সব একদম উজাড় করে দেয়. In fact, what she has given to the Gupta family, it's a kind of envy for so many of us. You see, Dr. Gupta was talking about his father. I remember, Doctor, introducing your father on similar platforms many a time. A true picture of humility. And you got a sample of what he created at Thakur Pukur. Dr. Swaraj Gupta remains in our hearts as the pioneer of comfortable treating of cancer patients. And he has taken this spirit of service towards patients to a new level. And I'm so glad that Dr. Arnab Gupta is carrying on this rich tradition, this noble tradition of his illustrious father. But on the lighter note, I must say that what has been a loss to the world of music and maybe aviation has been a tremendous gain to the world of surgical oncology. Courtesy Dr. Arnab Gupta. Thank you very much for such a enlivening conversation with our friend here, David Mantosh. From Mantosh, it's become Mantosh. That's, of course, that's all in the, because are you related to the same family, the Paul Mantosh and the John Mantosh and others?
Paul is my second brother. John is my fifth brother.
Okay. So that's the famous Mantosh family of Kolkata. Thank you very much. You have been an example of hope, an example of courage, and of cooperation with the doctor. We would request Shumita Singh to kindly come up and greet David Mantosh. Gupta Singh is the Secretary General of the Public Relations Society of India at its headquarters. And may I now invite Nivedita Banerjee. Nivedita, are you here? Oh, you're here. Secretary Treasurer of the Public Relations Society of India to greet Dr. Arnab Gupta. Thank you, Doctor.